Bob worried about being responsible for bad things that could happen. He worried about leaving the stove on, which could cause a fire, or hitting someone with his car. He spent all day repeatedly checking every action to make sure he hadn't done something wrong or dangerous. For example, Bob would circle back in his car to check if had hit someone and recheck his locks over and over again at home to make sure the doors were locked. Bob also avoided using his oven for fear he might leave it on.
The key features of obsessive-compulsive disorder are obsessions and compulsions. Most people have both, but for some, it may seem as though they have only one or the other. Obsessions are intrusive, repetitive, distressing thoughts, images, or impulses. Obsessions are thoughts, images, or urges. They can feel intrusive, repetitive, and distressing. Everyone has bothersome thoughts or worries sometimes, for example, worry about money or whether or not we remembered to lock the front door or regret over past mistakes. When a person is preoccupied with these thoughts and is unable to control the thoughts, get rid of them, or ignore them, they may be obsessions. Obsessions are usually unrealistic and don't make sense. Obsessions often don't fit one's personality, they can feel unacceptable or disgusting to the person who has them. Obsessions cause distress, usually in the form of anxiety. People with obsessive thoughts will often try to reduce this distress by acting out certain behaviors, known as rituals or compulsions. Compulsions are things a person does to ease the distress from obsessions. Compulsions are behaviors a person does to relieve the distress they feel because of their obsessions. They can be overt, observable, or covert, hidden. While most people have preferred ways of doing certain things, e.g. a morning routine or a certain way to arrange items on a desk, people with OCD feel they must perform their compulsions and find it almost impossible to stop. Usually, people with OCD know the compulsion is senseless. However, he or she feels helpless to stop doing it and may need to repeat the compulsion over and over again. Sometimes this is described as a ritual. Common compulsions include excessive washing and checking, and mental rituals such as counting, repeating certain words, or praying. While compulsions often help relieve distress in the short term, they don't help in the long term. As a person with OCD gets used to doing them, the rituals become less helpful at reducing his or her anxiety. To make them more effective again, the person may perform them more frequently and for longer periods of time. This is why people with OCD can appear to be stuck, doing the same thing over and over again. For someone with severe OCD, these compulsions can take up a considerable amount of time. Even simple tasks can become very time-consuming, having a significant impact on a person's ability to manage their daily lives. These difficulties can result in significant shame, sadness, and frustration. Obsessive-compulsive disorder is common. About 2.5% of the population or 1 adult in 40 are afflicted, which makes it about twice as common as schizophrenia and bipolar disorder. It is also the 4th most common psychiatric disorder. It can be severe and debilitating. OCD can invade all aspects of a person's life. Family, work, and leisure can all be negatively impacted by the disorder. In fact, the World Health Organization (WHO) considers OCD to be one of the top 10 leading causes of disability out of all medical conditions worldwide. Other facts about OCD: it affects people from all cultures. Rates of OCD are equal in men and women. It can start at any age, but the typical age of onset is adolescence or early adulthood. Childhood onset is not rare, however, tends to be lifelong if left untreated.
Thanks for watching. Please subscribe and comment for more content.